What is depression? Depression is a group of conditions associated with the elevation or lowering of a person's mood, such as clinical depression, persistent depressive disorder, postpartum depression, or bipolar disorder. Depression is the leading cause of disability in the world. Close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than a physical condition. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a long cold rainy day can bring on feelings of sadness. Sometimes there's no trigger at all, it just pops up out of the blue, then circumstances change, and those sad feelings disappear. Postpartum depression occurs after childbirth. Those who develop postpartum depression are at greater risk of developing major depression later on in life. Symptoms might include insomnia, loss of appetite, intense irritability, and difficulty bonding with the baby. Untreated, the condition may last months or longer. Treatment can include counseling, antidepressants, or hormone therapy. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It is a mental health disorder characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. It can linger for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Possible causes include a combination of biological, psychological, and social sources of distress. Depression can have a lot of different symptoms such as a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. It's not just behavioral symptoms. Depression has physical manifestations inside the brain. These include smaller frontal lobes and hippocampal volumes. Depression is also associated with a few other things like the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, and blunted circadian rhythms. It can also cause hormone abnormalities such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and the environment. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. So, if you feel depressed, make an appointment to see your doctor or mental health professional as soon as you can. If you're reluctant to seek treatment, talk to a friend or loved one, any healthcare professional, a faith leader, or someone else you trust. If you think you may hurt yourself or attempt suicide, call your local emergency number immediately. Also consider these options if you're having suicidal thoughts. Call your doctor or mental health professional. Call a suicide hotline number, reach out to a close friend or loved one, or contact a minister, spiritual leader, or someone else in your faith community. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person and call your local emergency number immediately. Or, if you think you can do so safely, take the person to the nearest hospital emergency room. If you know someone struggling with depression, encourage them gently to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area, or making a list of questions to ask a doctor. If they feel guilty or ashamed, point out that depression is a medical condition, just like arthritis or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it without help. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get. Try taking steps to control your stress and to increase your resilience and boost your self-esteem. Try to reach out to family and friends, especially in times of crisis, to help you weather the rough spells. Get some treatment at the earliest sign of a problem to help prevent depression from worsening. and consider getting long-term maintenance treatment to help prevent a relapse of symptoms. Do not stop taking any prescribed medications or treatments without consulting your doctor. The materials and the information contained on this channel are provided for general and educational purposes only and do not constitute any legal, medical or other professional advice on any subject matter.